Hi, everyone. This is Jen Bogdan. We're here with the Governor, Dr. Alexander Scott, and Director Smiley. We'll take your follow-up questions.
The conference is now in talk mode.
Governor, this is Ted Nisi. The New York Times just crossed a story that the White House is telling officials they may wind down the coronavirus task force in the coming weeks. Not clear.
What, Ted?
The New York Times just crossed a story saying that White House is telling officials they may wind down the coronavirus task force that Dr. Birx leads in the coming weeks. I'm just curious, do you think that would be a problem for the response, or do you think it's the right time to do that?
I think it's worrying. So, look, Dr. Birx has been really great and helpful to us. Having access to Admiral Giroir has been helpful. Having access, they've been helpful. So I don't think that's a good idea. I suppose if they set up a different structure where governors could have constant access and get good advice, that would be fine. But to just pull up the drawbridge and say, mission accomplished, we're good here, absolutely.
So it's fair to see the task force as the main conduit for you and the other governors right now to the federal government on all this?
Well, that's a hard question. No, I guess. It's a component of it. Mm-hmm. Like getting to the members of it is helpful. So as long as we can keep calling Dr. Birx and she answers our calls whenever we need her, as long as we can call Redfield and he answers our calls when we need him, as long as we call the Vice President, you know what I mean? We need access. We need access to Pete Gaynor. We are calling them like every other day. As long as they have access, give us access, then that would be fine. I also, though, if that is a signal, now that I'm thinking more about it, like, if we have the access, the governors will be fine. If they are signaling to us that they feel we're out of the woods and and this is a ratcheting down of their urgency, that's a signal that I find problematic.
Thank you.
Governor, will that affect, if this task force does wind down, is that going to affect, or how would it affect your plans to reopen the state? Is that really an important tool for you?
It just means they'll have to work harder. I'm going to make them pay attention to our needs. That you can rest assured of. It'll just make my job a little harder.
Mm-hmm. Thank you.
Governor, this is Michael Blow from Motif. You mentioned a one-stop app, and that's come up several times over the last few weeks. We talked about Salesforce getting involved, SurveyMonkey, and so on. And the questions have been raised from a number of parties as to what sort of privacy implications there would be with an app. So how do you see this app? What is it you're contemplating? Is it something that would involve just asking people questions like, do you have symptoms today? Or is it more specifically involved in trying to track people by location, or even in trying to correlate contact tracing, whether you've been near somebody who turns out to be infected?
Yeah. So the answer is all of the above over time. So like any software, we'll roll out an initial version, and then over time, in the coming weeks, we'll add more bells and whistles and functions. The vision where we want to get is that on a single app, you could keep yourself up to date and get information, like all the support that I was talking about, as well as information from the Department of Health. There would be a symptom tracker where if you're sick or in quarantine, you'd interact a few times a day via text and also track your symptoms. There'd be a log for where you've been. And we're thinking of, we're trying to figure out what's the right GPS or Bluetooth technology to do some automatic location tracking of where people have been. what I want to emphasize is that any of this will be totally opt-in. No one's ever going to be forced to do it or penalized if they don't. They'll be given the option to opt in. Everyone will maintain control over their data. And at every point, people will have a choice around what they want to share with the Department of Health. So tomorrow for the presser, I'm going to be talking about contact tracing and I think testing. But to preview it now, like next week, there'll be a version 1, which will have some of this technology, and then a few weeks after that, there'll be a version 2, which will have more robust technology. And you should be able to order all your tests, too, like all from the same app to go get yourself a test or an appointment.
Governor,
I want to follow up on my question about Father Marcel Talion. He's the pastor of St.
We'll come back. Yep. Sorry. Hi, Patrick.
Hi. Yeah, can you tell us what you're thinking as we get closer to the reopening of the economy on interstate travel and the quarantine for interstate travelers now? What's your thinking that's directing you on that?
As I said, on Thursday, I'm going to make that clear. We're still working through all the details. But I can tell you my thinking, which is I don't expect much to change in Phase 1. Phase 1 is a very limited re-entry. So if you're working from home now, you'll work from home then. If you are coming here from out of state and quarantining now, you'll probably have to do that then. So there might be a little more flexibility, but not much.
Is that a Phase 2
Just
thing?
to be clear on the Go ahead, Patrick.
Is that likely in Phase 2, more easing?
Yes, exactly, Patrick.
Governor, I just want to follow up on, so he's the pastor at St. Thomas More in Narragansett, Father Marcel Talion, and here's what he wrote verbatim. He posted this on Sunday. I made this video privately made available to Governor Raimondo's staff last week. This morning I received word she had not changed her mind. That's about the funerals. So I wasn't numb. I was trying to find out. You said you had not seen the video, but you know what? Someone on your staff did view it and did communicate with Father Marcel Talion from St. Thomas More. His question, and it's a very thoughtful, short 3-minute video, is about the number of people allowed at a funeral.
Can I look at it, talk to my folks that are dealing with churches, and have Jen call you in a little bit?
Sure. Sounds good.
Governor Brian Crandall, just when Phase 1 starts and you're allowing non-critical retail, just to be clear, would that also include the malls like Warwick and Providence Place? Although I guess Providence Place also depends on what the mayor does. But would that include mall spaces as well?
So what we're thinking of is not reopening indoor malls because we cannot guarantee, we cannot allow congregating, basically. We cannot allow any congregating. And by the way, we've been in touch with the mall owners and operators of all the major malls, and they've all told us they're not ready to reopen. So I think what we're going to do is if it's an outdoor mall like Garden City, then you will be allowed to open with the new restrictions. And if you have a door that faces the outside, and you're a retailer, so like if you're a retailer on the perimeter, then we will allow you to open. Does that make sense?
Thank you.
Yeah.
Governor, have you spoken to Mayor Lorza about your plan for Phase 1, and are you two on the same page, or do you anticipate, the mayor so far says he's supportive of your plan. We haven't seen details yet, but have you two spoken about it?
Yes, we're working through it.
Dr. Alexander Scott, Providence will go the way of the state on Saturday?
I don't know, Steph. This is a real time, like today, tomorrow, working through it.
Okay. Thank you.
Dr. Alexander Scott, how are we on PPE throughout the state? With the masking requirements, we're seeing a lot of people in surgical masks, even N95 masks. Is that something that's appropriate at this point? In other words, do the first responders and frontline workers have sufficient higher grade masks at this point? Obviously, you're kind of advocating for cloth masks, but just being realistic, is that appropriate for the average person to wear a surgical mask at this point?
We have definitely built up the surgical mask supply and have been able to really prioritize our healthcare workers by pushing out what we have to specialty docs and primary care docs, which is our focus. We do want to help make sure that critical infrastructure workers have the cloth face mask that they need to get the work done, and we'll work towards supporting that as well. So there is enough if people are able to buy cloth face masks or the surgical masks, that's acceptable. We do not want members of the public going to buy N95 masks, because those need to be preserved for our healthcare workers caring for COVID-19 patients. That's specifically the population that we want to have it, and it's important for us to message that because that's supply need that we are continuing to address.
Governor Raimondo, this is Tom Mooney. I had one question on your executive order on face coverings. Did you say toward the end that it would include civil penalties or not?
Yes. Yeah. So, yes, is the short version. And so I announced it today so people could start to get their head around it. It's going to be in effect on Friday. And we're working through the details of exactly what the penalties would be, exactly who's excluded, et cetera. But yeah, there will be fines, and we're trying to figure out exactly how to administer that.
Okay, thank you.
Governor, this is Rachel Nunes from Rhode Island Patch. I had a quick question about those logs you asked everyone to do, like who you've seen, where you've been. Are people going to be asked to continue doing that, or are we going to start to stop doing that once things reopen?
No, absolutely you need to do that. It'll become more and more important as our networks expand. Now, hopefully, with our new app, it'll become more digital and automatic. But if you decide not to opt into the app and you want to do it on paper, it'll be more important than ever.
Okay, thank you.
Basically, to paint a picture, now if you test positive, you get a phone call from the Department of Health and they interview you extensively and ask you where you've been, who you've talked to, who you've been with, yada, yada. In a future world, you would have had your app enabled and it will, pull up a log for you. But either way, contact tracing is going to be more important than ever.
How do you anticipate, Governor, expanding contact tracing capability numerically by, say, the end of May? Number of people who will have their contacts traced, and also number of people doing the contact tracing for the state?
I can't recall that off the top of my head. We have over 100 people full-time doing nothing but that. And I can't remember. Oh, do you know? Hang on, they're trying to show me the number of contacts.
But I'm primarily curious as to where we stand now on that and where you want to be in a month or 2 months.
Yeah. Let me get back to you. Right now, we have like 90 people doing it full-time. on any given day, we will attempt to reach over 1,000 people, and our goal is to have our investigations, all of our investigations done within a couple of days from the time that somebody gets a positive test.
Governor, I'm just wondering, you mentioned yesterday in passing, you're hoping to do phase 1 starts Saturday, and then you talked about getting to phase 2, and you suggested that could be maybe 2 weeks of phase 1. I'm just curious how strongly you feel 2 weeks is a good estimate following phase 1, because last year, that's, you could see it lasting significantly longer potentially.
Cut out, Ted. Just say the last sentence again.
Oh, sorry. Just wondering how strongly you feel a 2-week estimate for phase 1 is likely.
Yeah. Well, it'll totally depend on how it looks. So the trigger to go to phase 2 will be much like the trigger for phase 1. So we'll go back to those same 6 criteria. And I say 2 weeks because we'll need, to see another 14 days of stability. So it's hard to say. We'll need 14 days of stable or declining hospitalizations, stable or declining cases, no more than 30% of the ICUs used, all those check marks. But in the best possible case scenario, you'd hit the 14 days, within 14 days.
All right, everyone, we're out of time for today.